Welcome to the Fed to Fed podcast MHS Digital Front Door series. In the special collaboration with the Leidos Partnership for Defense Health, we explore what it takes to drive digital transformation in government healthcare. Through candid interviews and virtual panel discussions, we're driving thought leadership on tech innovation in government healthcare. We are so happy to have you tuning in today. We're pleased to announce our Fed to Fed series focused on MHS Digital Front Door in collaboration with valued federal government partner organizations and members of the Leidos Partnership for Defense Health. We will explore how to drive digital transformation in government healthcare, and we're very happy today to have Dr. Kosiak with us, an accomplished physician and Leidos Chief Medical Officer. He's tuned in with the latest and greatest in how the federal government is transforming healthcare for active duty and others across the military health system. The MHS is a complex system that weaves together healthcare delivery, medical education, public health, and private sector partnerships. Dr. Kosiak, welcome, and thank you so much for joining us today.
Wow. Thanks, Susan, for having me today. I spent a little time just introducing myself, if that's okay, and then maybe some of the latest of the MHS Genesis Electronic Health Record Initiative. That sound fair?
That would be fantastic.
Well, first, thanks. I guess you'd call me a physician executive. I have more than 25 years of experience in healthcare industry and a decade or more of senior management experience leading diverse teams in both the federal and commercial markets. I have a proven track record of serving multi-billion-dollar organizations, both in the nonprofit and for-profit space, and I have literally had the luxury of being at the forefront of healthcare transformation. I'm well-versed in the changes that are needed to ensure that the military health system meets the challenges for the next 50 years. I'm a practicing emergency physician, a husband and a father of 3 outstanding children, and I say that because they might eventually listen to this. I'm also a practicing physician in the military health system. I'm a colonel in the South Dakota Army National Guard, serving as the state surgeon. And I'm also looking forward to the shared electronic health record between the VA and the MHS as a card-carrying member and patient of the VA health system. And now a little bit about Leidos. Leidos is a global innovation company rapidly addressing the world's most vexing challenges in national security and health. We collaborate to create smarter technology solutions for our customers. And as the tagline says, we're working to make the world safer, healthier, and more efficient. Our healthcare mission is based on foundational core capabilities in healthcare. They revolve around digital modernization, like the MHS Genesis program, mission software systems, life sciences research, and managed healthcare services. What really differentiates us from our peers in healthcare is that we literally span the market from clinical bench research to advanced patient care. Think of our healthcare sector as a healthcare company that supports technology services versus an IT company that supports healthcare. That is a key differentiator in Leidos' success in this marketplace. Let's focus a little bit on MHS Genesis. It's been a long journey modernizing and transforming the military health system. MHS Genesis has been a central tool to help drive this transformation. We have had a great partnership between the government and our Leidos Partnership for Defense Health. And we've been providing wicked smart teammates to ensure the best and the brightest have been brought to the endeavor. Over the last 7 to 10 year journey, MHS Genesis is now live and operational at all DoD garrison facilities across the globe, making it the world's largest electronic health record system. We're deployed at nearly 4,000 locations across the globe, and we literally have hundreds of thousands of unique users. The system, if you can imagine, serves approximately 10 million beneficiaries. And as mentioned above, as a VA patient, I'm really excited to report on our successful deployment of the system at the Level Federal Healthcare Center, a joint DoD and VA accomplishment. But this successful deployment is just the beginning of the journey, not the end. We now have the fundamental building blocks in place to reach the next level of transformation, and we are now equally motivated by the future and what lies ahead on the horizon.
Dr. Kosiak, could you tell us a little bit more what's to come? What does the future look like?
Well, the future is bright. We have been spending the last few years tightening up the last few deployments globally, and now in concert with the VA and the federal health systems that they share between the VA and the DoD. And we're looking now to transform the health system in new and innovative ways, using that electronic health record as the baseline for that transformation to begin. So an example is the initiative called My Military Health, which is a transformative effort taking place within the MHS network. This new digital front door helps deliver on the brand promise of care anywhere, meaning the front door for which you access the system should not dictate the standard of care or the type of care that you get. Whether you come in virtually or into a physical brick and mortar site, the care is the same. That's the brand promise of what the MHS is trying to accomplish. They want to do that in the framework of value-based care, which is a change from the traditional volume-based care, where things are counted on the number of sick patients you've seen instead of the population wellness that you can maintain. That transformation is ongoing today. We're creating cohesive, patient-centered experiences that transcend traditional healthcare delivery models. And we've been harnessing the power of data, all of that data that we've been collecting over the last decades on the service members and their families. And we're augmenting that with the artificial intelligence to support the patient, their family, and their providers in the longitudinal healthcare journey.
Wow, that is so exciting. Taking a look at how far they've come and where everyone is heading and where MHS is heading in this program. So we're very excited about this podcast series coming up to talk and dive in a little bit deeper about the digital front door. Can you tell us a little bit more about what to expect from this series?
Well, I too am very excited to kick off this series. It is going to be a fantastic set of podcasts and personal events and professional events that you can join and that you can replay. And you are going to be excited about the cast of characters that we are bringing together. So first, the government's mission for success depends heavily on this digital transformation. This is something that all of healthcare is undergoing now, and it's not unique to the military health system. As we've talked about, it's including creating this robust digital front door or portal for which healthcare services can be accessed across the globe conveniently and efficiently. And we're excited about that future. And so we're going to bring to you, hearing from the government directly, as well as the Leidos Partnership for Defense Health, members to share the goals and direction and future of the MHS. Our first installment was going to really set the stage, where we're going to highlight where we are today with the MHS Genesis electronic health record rollout, but more importantly, where we're headed in the near future, really bearing down on the enhancements, including, again, the Defense Health Agency's My Military Health Initiative. We're going to focus on a number of key topics, including digital first, cybersecurity and zero trust, the enterprise telecritical care and hospital-based telemedicine opportunities, and then key partnerships with the new and advancing technologies that are coming out of the commercial environment, and many, many more. Again, we're really excited about the opportunity, and we'll be joined by a number of thought leaders from across the government, not just DHA in particular, as well as the industry, to really dig deep into some of these really tough and vexing challenges and topics, with the latest trends and how we collectively improve healthcare for those that need it most.
Thank you so much, Dr. Kosiak, and congratulations on all that's been accomplished to date for those who serve or have served and their families, and also to announce this important and exciting series. We are so looking forward to the coming installments. I'm Susan Scher, and thank you for joining us today. And stay tuned for our next installment in our MHS Digital Front Door series. If you enjoyed this episode, please don't forget to visit the DHS Digital Front Door landing page at govtechconnects.com for the latest in MHS thought leadership. Thank you all so much for joining us.